COVID-19 vaccine. CVS is limiting access to the shot in several states, including PA. It comes amid turmoil among the nation's top health leaders and the CDC. ABC's Selena Wang has more.
With changes to vaccine policy fueling the turmoil at the CDC, confusion over how and where Americans will get the new COVID vaccine. Just as the new vaccines are rolling out to pharmacies across the country, CVS announcing it will limit access to the shot in 16 states, requiring prescriptions in 13 states, including New York, Florida, and Colorado, and simply not offering it in 3 others. It comes just days after the FDA approved the COVID vaccine for this fall, only for Americans over 65 and adults and children at high risk. But a critical CDC panel is not expected to give their recommendation for several more weeks.
Because of that uncertainty, it is putting a lot of hesitancy among pharmacists and patients around what that coverage may actually look like at the end of the day.
The White House insists the vaccine will still be available for all Americans who want it, but pressed on whether insurance will continue to cover it, the White House sidestepping.
The FDA's decision does not affect the availability of COVID vaccines for Americans who want them. We believe in individual choice.
The White House also quick to note less than 25% of Americans get the booster each year. It comes as HHS Secretary Robert F. Kennedy Jr., a longtime vaccine skeptic, has been overhauling the nation's vaccine policy, this week ousting the head of the CDC, Susan Monarez, when she refused to get on board with his changes. Her lawyers saying she refused to rubber stamp unscientific, reckless directives and fire dedicated health experts. Kennedy charging ahead, naming his deputy Jim O'Neill as the interim director of the CDC, who has said he supports vaccines but not vaccine mandates. Selena Wang, ABC News, Washington.